Hi on 89.1 Radio 4 FM, number one for Hit Gaane. My name is Sapna, and today in the studios we have Dr. Bindiya Jhamb with us, who is Obstetrics and Gynaecologist, NMC Royal Hospital, Khalifa City. Hi doctor, how are you?
Hi Sapna, I'm very well, thank you.
Okay, so to initiate with, I have this question for you, doctor. What is considered as healthy or full-term pregnancy, and what are the various stages of pregnancy?
So Sapna, first of all, I would like to thank you to give me this opportunity to send a message out to all our pregnant women out there in the community. To answer your question, I'd like to break it down in two parts. So healthy pregnancy and a full-term pregnancy means that basically a mother and baby or babies, they have no complications. And by full-term, what I mean is that it is completed right up till 40 weeks. The second part to your question, what are the various stages? We tend to divide our pregnancy into three parts. The first trimester is until 12 completed weeks of gestation or 3 months. The second trimester is any time after 12 completed weeks until 28 weeks. And the third trimester or the last trimester is after 28 weeks until 40 completed weeks.
Okay.
So if a woman delivers before 40 completed weeks, rather before 37 completed weeks of gestation, we call it a preterm delivery.
All right. Okay, let's talk about the common symptoms and the problems of pregnancy, doctor.
So first and foremost, I would like to tell pregnant women out there, pregnancy is not a disease. There are some changes that go on in the body which are part of pregnancy. To name them, it's nausea and vomiting in early pregnancy. So a woman who's pregnant is expected to experience some sort of what they generally come to me and say giddiness. That's normal. It can go on until 16 to 20 weeks. And in most cases, these women can be reassured that it is not going to have a poor pregnancy outcome. The other common symptom to look out for in pregnancy is heartburn. So it is also, some women call it as acid reflux or acidity. And I would say, again, this is related to various hormonal changes that go on in your body during pregnancy. Lifestyle modifications and diet modifications help with the heartburn. Sometimes we may need to provide antacids, which are safe in pregnancy. The other common problem that can happen in pregnancy is constipation. Again, it is due to the physiological changes that go on in the body during pregnancy. And these are all hormone related. Diet modification in the form of increased fiber supplementation helps with constipation. And if it doesn't help, we have medications out there to help, which are again safe in pregnancy. The other common problem is backache, which is because as your pregnancy advances, there is a pull on all your tissues in the back and in your tummy. So one way to deal with backache is to exercise in water, what we say is aquatherapy, massaging, and sometimes taking pain relief medications like paracetamol. That helps with backache. So in summary, I would say nausea and vomiting in pregnancy, heartburn, constipation and backache are common in pregnancy. But when you're in doubt, it's best to seek advice from your obstetrician.
Well, that was quite information on pregnancy and the symptoms and the problems that a lady goes through. Doctor, also will talk about the nutritional supplements in just a while, okay?
Yes.
All right, so that is Dr. Bindiya Jhamb with us, and we're going to be back to you guys. Stay tuned, stick around to 89.1 Radio 4 FM, number one for Hit Gaane. My name is Sapna. Hi and welcome back to the show. This is 89.1 Radio 4 FM, number one for Hit Gaane. My name is Sapna and I have Dr. Bindiya Jhamb with us, who's Obstetrics and Gynaecologist, NMC Royal Hospital, Khalifa City. So doctor, let's talk about nutritional supplements which are required during pregnancy.
Thank you once again, Sapna. So nutritional supplements in pregnancy are varied. I generally do not tell my patients to start with multivitamins and iron just because they are pregnant. However, one very important nutrient is folic acid. And this should be commenced even before a woman thinks of embarking on her pregnancy. It should be taken in the dose of 400 microgram at least 3 months before starting her pregnancy, and to continue it throughout until first 12 weeks. And I shall tell you the reason behind it. Folic acid is a very important aspect in the development of neural tube. And if there's a deficiency, the baby can have neural tube defects. The other nutritional supplement is iron. However, it is not what I routinely prescribe to my patients. It's only if their hemoglobin levels or the iron levels are below a certain level. I would like to give a message out there not to go for vitamin A supplementation. On the contrary, it can be teratogenic. In other words, it can harm the baby. So it's best to stay away from vitamin A. However, vitamin D is extremely important. And I note many of my patients who I have seen over here, they have deficiency of vitamin D. And my advice is to start vitamin D supplementation, 10 micrograms per day, which transforms into about 400 international unit in your calcium and vitamin D tablets. So this is the nutritional requirement or supplementation required during pregnancy.
Okay, doctor. Also, we'd like to discuss things to avoid in pregnancy, or commonly known as lifestyle modifications, do's and don'ts of pregnancy as well.
Right. So there are lots of do's and don'ts in pregnancy or lifestyle modifications. Starting with, I've had a few women who've asked me whether they should continue working. As I've alluded to it earlier, pregnancy is a major physiological change in the body, not a disease. Hence, I would say, majority of women, they can be reassured that it is safe to continue working during pregnancy. Obviously, what we need to bear in mind is the occupation of the woman. When it comes to eating, pretty much you can have whatever you fancy. However, there are some things to avoid. For example, avoid soft cheese like brie. Avoid having pate, uncooked or undercooked, ready-prepared meals. Avoid having raw or partially cooked eggs. Avoid partially cooked meat, especially the poultry. And the reason behind it is that there can be increased risk of certain infections like Listeria and Salmonella. The other thing is what to do with the exercises. So I would like to inform my pregnant women that beginning or continuing a moderate course of exercise during pregnancy is not associated with adverse outcomes. However, avoid contact sports, high-impact sports, vigorous racket sports, because these are involved with the risk of trauma to your tummy or falls or excessive joint stress. And all this can result in problems with your baby, like birth defects. So it's best to avoid all these high-impact sports. The other thing that I would like to draw attention to women out there is that sexual intercourse in pregnancy is not known to be associated with any adverse outcomes. However, it's important to avoid drinking alcohol and smoking, because both these can have an impact on the baby. So alcohol is associated with an increased risk of a miscarriage, and smoking in addition is associated with having small babies or having preterm births. And quitting smoking at any stage of pregnancy is always an advantage to the baby and the mother's health.
All right.
Avoid using harmful substances like illicit drugs. Also, I would like to tell pregnant women that take special precaution when you are undertaking a long-haul air travel. And this is because there is an increased risk of having clots in your legs and lungs. Also, check with your airlines when you are flying whether you can fly above a certain gestational age of your pregnancy. Seek advice from your obstetrician before going out on a long-haul air trip. And lastly, but importantly, pregnant women out there, I advise you to wear your seat belts correctly, please. Follow the 3-point rule. That is, have the seat belt above the bump and below the bump, but not over it.
All right, so we're going to come back and there's more information coming on pregnancy and how to deal with it right on Radio 4. Stay tuned, stick around with me. My name is Sapna and I have Dr. Bindiya Jhamb with me. Hi and welcome back to the show. This is Sapna with you, and yes, today we have Dr. Bindiya Jhamb, the gynecologist, with us from NMC Royal Hospital, Khalifa City. All right, doctor, last question that I have for you is what steps can one take to promote healthy pregnancy?
Lovely. Thank you once again. So, there are various steps to promote healthy pregnancy even before you start upon your pregnancy. Importantly, approach your obstetrician to sit down and talk to her about your apprehensions, which I call as a pre-pregnancy counseling. And we at NMC Royal Hospital are here 24/7 to guide you with that. Once a woman is pregnant, regular antenatal care is advised. A number of visits would depend on how your pregnancy is progressing. It can vary even with your own previous pregnancy, and it's very difficult to compare two pregnancies. Each pregnancy is different. Eat healthy. Avoid harmful substances like alcohol, smoking, and illicit drugs. Be mindful of weight gain during pregnancy. And here I would like to say that those women who have a body mass index of less than 19, they can put on weight anything up to half a kilo per week when they are in their second and third trimesters. However, for women who have a body mass index of more than 30, which is overweight and obese, this translates into a weight gain of no more than quarter of a kilo per week. And lastly and most importantly, when in doubt, do not hesitate to seek advice from your obstetrician. And it would be a great pleasure for us to be a part of your journey here at NMC Royal Hospital to look after your pregnancy right to the very end of delivering you. Thank you.
All right. So that was Dr. Bindiya Jhamb with us, gynecologist, NMC Royal Hospital, Khalifa City. Thank you so much, doctor. And I hope that was really a fruitful information for all our listeners today on the show.
Thank you very much.
Thank you, doctor.